afternoon, America. If you're just tuning in now, my name is Melissa Peters, and I'm your host tonight. During today's show, I've talked to 18 esteemed healthcare professionals. To finish off the afternoon, please welcome our 19th guest, Ms. Claire Keller.
Hey Melissa, and thank you so much for having me on tonight.
And thank you for coming. Now, Claire, I brought you here this afternoon to learn more about what you do in your career as a home healthcare nurse. Now, we've seen a booming demand for home healthcare professionals in the last couple of years. Why is that?
Well, with advancements in medical technology leading to more accessible, personalized care, patients and their families are able to combine the creature comforts of home with the needed care from the hospital. There's no need to withstand the sometimes cold and unforgiving atmosphere of a hospital room, and you can just stay at home and get the care you need.
Now, what exactly are your duties as a home healthcare nurse? As you described, a nurse must have the responsibilities of a hospital nurse and as well as a stay-at-home parent. How do you balance these strenuous duties?
Well, Melissa, it's certainly not easy, but if you're doing something you love, any amount of work is pleasant. And after a while, all the separate duties of a home healthcare nurse become one routine. Working in close proximity to patients and their families definitely help because you develop a sort of bond with your patient.
And what exactly are these duties you do?
Well, on a typical day, I'm responsible for cleaning and dressing wounds, administering medication, monitoring patient health and needs, and documenting symptoms and vital signs. The documentation of symptoms and vital signs is pretty important because as their caretaker, I need to maintain that they have normal vital signs to make sure that their conditions aren't worsening. Instructing patients and their families on proper home care and providing encouragement and support to those patients is definitely my most important duty.
It definitely sounds like a lot of work. Advancing to your level of professionalism couldn't have been easy either. How exactly did you get to where you are now, like schooling, testing?
It's actually a pretty well-defined path. I got my bachelor's degree at the University of Minnesota in the Twin Cities in nursing, of course. You don't have to start with a bachelor's degree. You can start with an associate's degree or just a diploma in nursing, but a bachelor's degree is what employers most often look for. While I completed my classes to get my bachelor's degree, I found a lot of volunteering opportunities at the local hospitals, so I had more hands-on experience with patients.
Is volunteering a part of traditional curriculum as a home healthcare nurse?
Well, it depends on the program. I know it is for some, but it wasn't for mine. I just chose to volunteer because hands-on experience with the patients as I was learning the material to help those patients really helped me apply what I was learning to what I could do.
Continue, sorry.
After I had finished school, I had to become licensed, obviously. All nurses must take and pass the NCLEX-RN to become a licensed nurse in the state they practice, so I took mine for Minnesota so I could stay in Minnesota.
Okay, and then you can practice as a home healthcare nurse?
Exactly. Of course, to gain a reputation and work with clients, most nurses orient themselves with a hospital or a private practice. Before you're hired at most private practices, you have to have a couple years of experience, usually working in the intensive, emergency, or critical care units of a hospital.
Of course, that's way too many years of practice for me. Tell me that at least. I hope this isn't intruding. You make a good amount of money?
That's not intruding, don't worry. It's important for professionals, especially professional women, to share what they make. Sharing salary information makes it harder for those who sign our paychecks to pay employees who do equal work different salaries. Anyways, with my current job at a private practice, I make around $50K a year. Depending on whether you work at a private practice, which you're paid better at, or if you work at a hospital, a home healthcare nurse makes between $39K and $55K per year.
$50K sounds like a really substantial amount.
It is, and for the career that you're able to do while making that money, it's definitely worth it.
Anyways, Ms. Keller, thank you so much for joining us today. I know our viewers will appreciate the information. That's all, folks. Tune in tomorrow afternoon for another lovely session of Good Afternoon America.